Dr. Ouellette. I think I'm the last person in my neighborhood to jump on the pickleball train. I played a little tennis back in the day, so I'm curious just how different pickleball is. Are you seeing the same kind of injuries for both sports? So I played a little bit of tennis too in my, younger days. Thought of picking up pickleball. What are your thoughts?
Definitely seeing many of the same kind of injuries.
Really?
Right. And that's because, you've got that flick of the wrist. And of course, when did you start playing pickleball? 50 to 60 years old. So remember, I already told you 80% of dead people have a TFCC tear. So it's no big surprise that you would then begin to recognize that TFCC. Same story. Wear the splint night and during the day as you can. Wear the lion's paw for working out. Use the wrist widget for playing pickleball. And do as much as that as you can over a 3 to 6 month period to see if this works. Because here's the other wonderful thing. If you need surgery, if you realize, I'm not going to be able to play pickleball and I really want to do that, and I'm going to explain to you why you want to in a minute, is this surgery the same and has the same surgical outcome no matter when you do it? Yes. It doesn't matter whether you do it now or 2 years from now or 5 years from now. It will be the same outcome. So unlike the scapholunate ligament, which does have a history of arthritis developing over a 2-year period, these other injuries that occur with pickleball and tennis, not so much. So you have time. And many times, just like in the NBA, this is going to settle you down and get that to hold up. And now, why do you want to play pickleball? Let's go into that. Because you actually do. You want to play racket sports because it turns out that racket sports have the least cognitive decline and dementia. Isn't that interesting?
Wow,
I
that's
suspect that has to do with physics, i.e., you have to interact with the ball, you have to know where your body is in space, but you also are communicating to your competitors across the net and your teammate next to you. And so with that, it allows you to be one of the best you can be in terms of health. And so that community, that interaction with other people, and then that interacting with the physics of a ball, a racket, and a net, and it seems to really help with cognitive ability. So yes, you do want to play pickleball. So we want to find ways to keep you on the court and not in casts and getting surgery, okay?